I already done 4 pages of vertebral column. This is 5th page. There are processes of the vertebra and description of the processes. The most important information is the zygapophyseal joint or apophyseal joint, which is formed by superior articular process and inferior articular process. Information is articular pillar, which is also formed by superior and inferior articular process. Two foramens, intervertebral foramen and vertebral foramen. Spinal nerve forms in the intervertebral foramen, and vertebral foramen boundary is anteriorly posterior surface of the body of the vertebra, posterior laterally inner surface of the vertebral arch. Vertebral foramen is large at two regions, which is the cervical and lumbosacral region. Next page. There is contents of vertebral foramen, spinal cord and meninges, ossification of the vertebral column or ossification of vertebrae, 3 primary ossification center and 5 secondary ossification center. 3 primary ossification center, there is 1 center for the body, 2 center for the arches, and 5 secondary centers. There are 3 spinous and transverse process, and 2 for upper and lower surface of the body of the vertebra. Intervertebral disc is another important topic. There is no intervertebral disc in between atlas and axis. Vertebral disc is fibrocartilaginous and kept in position by anterior and posterior longitudinal ligaments. 2 parts of intervertebral disc, annulus fibrosus and nucleus pulposus. Annulus fibrosus, composed of fibrocartilage, consists of many concentric layers of collagen fiber, limits rotation of the vertebra. Nucleus pulposus is semi-fluid in nature. Commonly asked, what are the remnant of notochord? 2 common remnant of notochord is nucleus pulposus and apical ligament of the dens. The nucleus pulposus is an example of mucoid connective tissue. The remnant of notochord, nucleus pulposus, act as a hydraulic shock absorber. Clinical importance of intervertebral disc prolapse. Protrusion of nucleus pulposus generally occurs at lumbar and cervical region, in between lumbar 4 and lumbar 5, or lumbar 5 or sacral 1, between cervical 5 and 6, or cervical 6 or 7.